So the problem is when you want to see a doctor, you have to go to a government clinic, which is for a lot of people very far away, or you go to a private clinic, which for a lot of people is quite costly at about at least 70 ringgit and above, because depending on how much of medicine it takes, it could even reach 100, 110 ringgit in some cases. So this is the challenge that a lot of people face, especially the lower income in our community, to access primary health care. So this is your GPs that you visit when you have the flu, when you're not well, and so on. So this program, we got a good price from Doctor Anywhere, plus we add on some subsidy from our side. For only 5 ringgit, our B40 community in Bukit Gasing can visit a doctor on their phone, no travel time. From their house, they can do so. Only 5 ringgit for the doctor consultation. After the doctor consultation, the doctor can prescribe them medicine, which they can purchase on the app if they want to, or they can purchase from a pharmacy near their house. Now there are pharmacies everywhere. Whichever they prefer, they can do so. The doctor can also prescribe them an MC, which they may need for their job, and that MC is a legally valid MC. All right, and can also provide them a receipt if they have an opportunity to claim the doctor visit from their employer. For some people, a small group of people may have that benefit and they could claim it. Okay, so how you consult the doctor is through your app. All right, so you get on the app. Can I borrow yours here? Okay, so you get on the app and you say you want to see a doctor, fill up your name, IC number and all that, and you wait your turn, which normally is minutes. Okay. Takes what? So you just there, consult the GP or consult a specialist. So if you're consulting a GP, see the next available GP now, if you want to see the first available doctor, or search for a particular GP. So there are about 50 GPs in this system. So by getting everyone to go to the government clinic, what happens is the government clinics are overcrowded, they are full. I've been to the Klinik Kesihatan Taman Medan a number of times as over the last few years as an adun. More than 5 times I've been there. I've seen the massive crowds. In fact, I've seen a doctor there just to experience it. I've waited for hours. I've the luxury of being able to work from my phone, so I don't waste my time. But it's very time consuming. It's not easy to find parking because most of these facilities don't come with sufficient car park. So if you're driving there, it's quite difficult to find parking. So it's not a very accessible way to visit a government doctor. However, platforms like this could change it, because not everyone needs to see the doctor face to face. If we can start moving people to technology like this, the same government doctor can see the same amount of patients one by one, and they don't have to travel. So this is a start. This is in a way a pilot project of sorts in a healthcare plan, but I hope that the Ministry of Health will pick up on this, and that it's my dream that one day we will see this being widely practiced. Then people don't have to spend half a day. You talk about traveling to the Klinik Kesihatan, waiting for your turn to see the doctor and traveling back. 2 hours at the very least, maybe even 4 hours. And many of these patients don't need to do that. They could have done the whole process from the comfort of their bed, where they should be if they are sick.